Ruth had been careful her whole life, so when her husband's memory faded to the point where he couldn't be left alone, couldn't dress himself, couldn't manage the stove, she found a good care home, moved him in, and told herself Medicare would handle it. He was 79 and on Medicare. This was medical. Of course it would. Then the first month's bill came, several $1,000s, and a note explaining, politely, that Medicare pays none of it. Ruth wasn't confused about her husband's illness. She was blindsided by a gap in Medicare that almost nobody is warned about until they're standing in it. So why doesn't Medicare pay for long-term care, the day-to-day help so many of us will need near the end? And if Medicare doesn't, who does? Today, in plain English, I'll show you the single most expensive misunderstanding in all of Medicare, and the moves that protect your family from Ruth's surprise. This video covers long-term custodial care. It does not cover the short-term rehab after a hospital stay, which is a different benefit with its own rules. Here's the rule, stated as plainly as Medicare itself states it. Medicare does not pay for long-term care. The kind of help we're talking about has a name, custodial care, and it's the ordinary, non-medical help a person needs to get through the day when they can no longer manage alone. Medicare was built to cover doctors, hospitals, and treatment. It was never built to cover someone helping your husband bathe every day for years. So let's be clear about what custodial care actually means, because it's the heart of this. It's help with what the rules call the activities of daily living: bathing, dressing, eating, moving from a bed to a chair, using the bathroom. When that's the only kind of help a person needs, not a nurse, not a treatment, just steady human assistance with living, Medicare's answer is that you pay all of the cost. And it isn't only Medicare. A Medicare supplement policy, a Medigap plan, doesn't fill this gap either. The most common assumption families make is exactly the one the rules don't allow. And this gap follows the care into every setting, which surprises people most of all. Whether that daily help happens in a nursing home, in an assisted living community, or right in your own living room with an aide coming by, the answer from Medicare is the same. The custodial part, the help with living, is not covered. People assume a nursing home must be medical enough to count. It isn't the building that decides it, it's the kind of help. If the help is with bathing and dressing rather than skilled treatment, the setting doesn't change the answer. Now, why does almost everyone believe the opposite? Because of a different benefit that sits right next to this one and gets confused with it. After a qualifying hospital stay, Medicare does help pay for a stay in a skilled nursing facility. But look closely at how it's built. It covers the first 20 days in full. From day 21 through day 100, you pay a share. This year, 2026, that share is $217 a day. And after day 100, the benefit stops entirely. That's the Medicare covers the nursing home people are half remembering. But notice the two words hiding inside it, skilled and 100. It's skilled care, a nurse, physical therapy, a medical reason, not custodial help. And it runs out at 100 days, at the very most. Ruth's husband didn't need skilled nursing after a hospital stay. He needed someone with him all day, every day, indefinitely. That isn't a 100-day skilled benefit. It's long-term custodial care, and it falls straight through the gap. So if Medicare doesn't pay and Medigap doesn't pay, who does? There are really only three doors. The first is your own money: savings, a pension, the sale of a home, paid out of pocket. And long-term care can run like a hospital-sized bill arriving every month. So that door can empty a lifetime of saving faster than anyone expects. The second door is Medicaid, which is a different program from Medicare. It's the one that actually pays for long-term care in this country, but only after a person has spent down their income and assets to their state's limit. Many families reach it eventually, but they reach it after the savings are gone. The third door is private long-term care insurance, a policy you buy in advance, years before you need it, specifically to cover this gap. Let me spend a moment on that second door, Medicaid, because there's a piece of it that eases one of the deepest fears. People hear "spend down your savings" and picture the healthy husband or wife being left with nothing while their spouse is in care. The rules actually try to prevent exactly that. When one spouse needs long-term care and the other still lives at home, there are protections. often called spousal protections, that let the at-home spouse keep a share of the couple's income and assets, and usually the house and a car. It is not all or nothing. The specifics vary by state, but the principle is that the well spouse is not meant to be left destitute. There's a companion rule you should know before you ever try to plan around this, though, because it catches people who mean well. Medicaid looks back at your finances over a period of years before you apply, commonly 5. And if you gave away money or property to qualify, it can delay your coverage. So the answer is not to quietly sign the house over to the kids the month before you apply. That backfires. The real planning is done early, out in the open, with someone who knows your state's rules, not in a panic at the last minute. And here's the quiet cruelty of the timing. The moment you need long-term care is the moment it's too late to prepare for it. You can't buy long-term care insurance once you're already sick. You have to buy it while you're well and don't feel the need. And you can't tuck away savings once the several thousand a month bills have started. Every real option lives on the other side of a door that closes right when the need arrives. That's why this has to be a conversation you have early, calmly, before anything is wrong. Has your family ever been caught by this? Assuming Medicare covered long-term care and finding out it didn't? If you've been through it, share what you learned in the comments. It genuinely helps the person reading who hasn't faced it yet. So here's what to do, and none of it requires a crisis. First, simply know the difference. Skilled, short-term care after a hospital is Medicare's. Long-term help with daily living is not. That knowledge alone changes how you plan. Second, if long-term care insurance interests you, look into it while you're healthy and younger, because that's the only time you can. Third, learn how Medicaid works in your state before you need it, the income and asset limits, and the rules about protecting a spouse who still lives at home, because those protections exist and families miss them. And fourth, talk to the people you love about all of this now, while it's a calm plan and not a panic decision made in a hospital hallway. And if you'd like real help sorting it out, for free, with nobody selling you anything, call your state health insurance assistance program, your SHIP counselors, at 1-800-MEDICARE, and ask your state's Medicaid office or a local area agency on aging about long-term care options. They'll walk you through your own situation at your pace. And if you want one concrete first step this week, here it is. Bring it up. Raise it at the next family dinner, gently, before anyone is in crisis. Who would help? What could be spent? What everyone would want. While you're at it, dig out any life insurance policies and check whether they carry a long-term care rider, because some do and families forget. And ask a counselor what your state's Medicaid limits actually are. None of that costs money. All of it turns a future emergency into a plan you made on a calm afternoon. Because this gap isn't a trick, and it isn't a mistake in the system. It's simply what Medicare was and wasn't designed to do. The danger is only in not knowing, and finding out the way Ruth did, with a bill in your hand. Once you know where the line is, you can plan around it, and that plan is one of the kindest things you can leave your family. So tell me below, did you know Medicare doesn't cover long-term care? If this made the gap clear before you had to learn it the hard way, then subscribe. Next, we look at something happier, the everyday shots Medicare already made free that millions of people are still paying for by mistake. This is general information, not financial advice, and not medical advice either. And we are not affiliated with Medicare, so always check your own situation. I'm glad you're here. I'll see you in the next one.